Methamphetamine is a stimulant drug. It speeds up the brain and the body's functions. It's known by a lot of different names, including speed, meth, crystal, and ice. While impressions from the media might make you think that meth is everywhere, rates of use are actually decreasing in Australia. 1.4% of the Australian population aged 14 years and over used meth in 2016, and only 6.3% have ever tried it in their lifetime. However, in many communities this rate is a lot higher, particularly if there is a high level of supply or availability. Methamphetamine comes in three main forms: crystalline shards, which is mostly called ice, an oily paste, which is often known as base, and as a coarse powder, which gets called speed. Crystal methamphetamine, or ice, is the most potent form of the drug and also the most commonly available form in Australia. Most people who used methamphetamine in 2016 used it in the ice form. Recently in Australia, we've seen an increase in availability as well as a drop in the price of crystal methamphetamine. This switch from speed to crystal meth is the main reason we're seeing so many more harms and problems. Methamphetamine primarily works by releasing a large amount of dopamine and other neurotransmitters like noradrenaline and serotonin into the brain. As a result, people who use methamphetamine feel increased levels of alertness, energy, confidence, and euphoria. They can also experience other effects including dry mouth, dilated pupils, jaw clenching, sleeplessness, a loss of appetite, increased body temperature, increased heart rate, and sometimes feelings of agitation, anxiety, and paranoia. It's worth noting though that not everyone who uses meth will exhibit these signs, especially if they've been using the drug for some time, because the body gets used to it and builds up a tolerance. Effects peak around 2 to 3 hours after consumption and last between 4 and 24 hours, with the strength of the effect depending on the amount used, how often the person uses it, how it's taken, and other individual factors like age, weight, and body type of the person using it. Most people who use meth only take it occasionally, but a small number of people find themselves using it much more regularly. The more often someone uses meth, the less they feel the effects of dopamine, and the harder it is for their body to produce dopamine naturally. This means that people can begin to feel unmotivated and depressed when they're not using it, and so then they need to take more of the drug to feel those desired effects. It's important to note that there is no safe level of meth use. Some people who use meth can experience anxiety, low mood, or feel scattered. More severe effects can be panic, strange or paranoid thoughts, and hallucinations. This is often referred to as psychosis. Fortunately, these symptoms usually go away after a few hours or when the person eventually catches up on some sleep. If these symptoms don't go away, or the person is so agitated or disturbed that you feel they're a risk to themselves or to others, immediately call 000 for emergency help. While many people can quit or cut back their use of methamphetamine all by themselves, some find it easier with help from family, friends, and health professionals. It's very normal for someone who uses methamphetamine regularly to experience problems with remembering, organising, goal planning, solving problems, focusing and completing tasks, and managing emotions. For people who have been using heavily, this can continue for up to a year or more after they've stopped. So it can make cutting back or quitting really difficult, and many people make several attempts before they make progress. Other things that can help are sleeping well, eating healthy, exercising, avoiding triggers, which are things that make the person think about using, and getting active by doing things like sport, hobbies, and social activities. Eating a good healthy diet full of protein and vegetables is particularly important as it helps the body to rebuild its natural stores of dopamine, which in turn can really help to lift the person's mood. People can and do make successful changes around their meth use. Help is available, and alcohol and drug treatment such as counselling, rehab and support groups have been proven to be effective. If someone is trying to quit, sometimes it can take a few attempts. Encourage them to learn from any slip-ups and keep going. Need to speak to someone? Call AIDAS Queensland for 24/7 alcohol and drug support. Or if you live outside of Queensland, you can call the national number on 1800 250 015. Insight is an initiative of Queensland Health, proudly delivered by Metro North Mental Health Alcohol and Drug Service.